Hello, I'm Austin Heyman. Welcome to Seniors Today, a monthly program produced by the Commission on Aging and devoted entirely to issues and interests of Montgomery County seniors. This month we learn about ways in which people can tell their personal life stories, and we have the opportunity to chat with the President of the County Council, George Leventhal. But first, the Center for Medicare Advocacy, established in 1986, is a national nonprofit, nonpartisan law organization that provides education, advocacy, and legal assistance to help older people and people with disabilities obtain fair access to Medicare. And joining us to tell us more is David Lipschutz, the Senior Policy Attorney for the Center. Well, welcome to Seniors Today, David.
Thank you for having me.
Well, Medicare is a complex subject, and you've been engaged in this effort for quite a while.
I've been working on Medicare issues from the beneficiary side going on about 15 years now.
Wow, and there have been a lot of issues.
Yes, sir.
Well,
Yes,
let's dive into this. One of them, as I understand, has to do with the coverage of hospital stays. What's the issue about that?
Our organization takes a look at a range of different issues that confront Medicare beneficiaries in our attempt to try to improve access to Medicare coverage. One of the most intractable issues that we've come across in the last few years has to do with this issue of so-called observation status. That's when someone is in the hospital for a few days, maybe multiple days. For all intents and purposes, they appear to be an admitted inpatient. They're wearing the hospital gown, they're eating the hospital food, and oftentimes they're getting the same care that inpatients are getting. However, the hospital designates some people as being under observation status.
Why would that be?
In part, it has to do with the way that Medicare bills and Medicare's efforts to review some of the previously paid claims, an effort to ensure Medicare pays for what it's supposed to pay. But it's had a very negative impact on Medicare beneficiaries, because if you're one of these folks who, for all intents and purposes, looks like you're an inpatient in a hospital, but you've been deemed to be under observation status, you're in fact treated as an outpatient. And that could have significant impacts on your ability to access Medicare coverage, both in the hospital and if outside of the hospital, for example, if you need subsequent care in a skilled nursing facility.
So if you, for example, fell and you had to have surgery or something in the hospital and you were there for 4 or 5 days or a week, and then you needed to go to a rehab place, that's where it might come into play.
Absolutely. In order for Medicare to cover a stay in a skilled nursing facility, sometimes called rehabilitation facilities, Medicare requires that that person first have what's known as a prior 3-day hospital stay. The person had to have been an inpatient in a hospital for at least 3 days in order to be eligible for coverage in a skilled nursing facility afterwards. People who are under observation status, however, are treated as outpatients, not inpatients, which means they won't satisfy that 3-day prior hospital stay requirement.
So how do you make sure that you're in the right category?
It's a tricky question that's tricked up people increasingly over the last several years. Some states, including the state of Maryland, recently passed a law that requires hospitals to inform individuals if they've been in the hospital for at least, I think, 23 hours and they're outside of the emergency room.
What their status is.
Exactly. That doesn't give them a right to appeal their status,
right,
but it does give them a right to a notice about their status.
A second issue I understand has to do with something called improvement standards. What do we mean by that?
There has been a long-standing myth in the Medicare program amongst the providers of care, amongst the insurance companies that process Medicare claims, that in order for Medicare to cover ongoing therapy, skilled therapy or skilled nursing, that's usually physical therapy, occupational or speech therapy, that someone must be demonstrating an improvement in their condition or their functional ability. That is not the case and has never been the case, but that myth is so widespread that people routinely are denied care to which they're entitled because of the application of this inappropriate improvement standard. Oftentimes, it'll be phrased in different ways. Sometimes you'll be, say, in a nursing facility and getting therapy, but told that your condition has plateaued, or you've reached maximum functional ability. Instead of this improvement standard, really, what the law is and what our organization, along with Vermont Legal Aid, brought suit against the Medicare program about is the notion that so-called maintenance therapy is covered by Medicare. Our organization settled a lawsuit with the Medicare program that reinforces the notion that the improvement standard is a myth and that Medicare can cover maintenance therapy in order to assist people maintain their current level of function or actually prevent their deterioration.
That sounds very important. Now, is your center a resource that people, is there a way of getting in touch with your office or to get a clarification of things?
Absolutely. Our office in Connecticut is our main office, and it provides direct services mostly to people in the state of Connecticut. We have offices in Washington, D.C. and a few other remote locations, but the best way to get information about observation status, about improvement standard, and other issues is through our website.
Do you want to give the website?
Sure. It is www.medicareadvocacy.org. And
Yeah, go ahead. I've looked at it actually, and it's terrific. Yeah.
Much appreciated. On that website, we have a number of self-help packets that help people walk through these different scenarios if they're confronted with denials of care or if they're in a hospital and deemed to be observation status, and provide some tips for dealing with that, both for folks who are still in the hospital and find out they've been deemed to be under observation status, as well as folks after the fact.
If you are an outpatient, I understand that, and you're looking for therapy, physical therapy or speech therapy, occupational, that there's a cap on the amount of money that you can draw on?
Yes. While the Jimmo versus Sebelius settlement, we think, goes a long way towards assisting individuals with chronic conditions obtain needed therapy, there are still certain barriers that are in place that Medicare beneficiaries face when trying to access medically necessary care. And one of those barriers is a cap on the dollar amount that Medicare will spend annually on an individual for outpatient therapy services. And that's physical therapy, occupational, and speech therapy.
And that cap is how much?
It's roughly $1,900 for the first level of therapy. There is a process through which an individual can request an exception and go beyond that dollar cap. And there's a second higher cap that requires even more supportive information. It was really put in as a cost-saving measure, but for individuals who need more than just a little bit of rehabilitation after, say, a fall, as you mentioned, particularly individuals with long-term and chronic conditions, it really serves as a barrier to getting meaningful long-term care and serves as an incentive for some providers to terminate care prematurely.
Well, you've been very helpful there. It's a complex subject, and we've covered a good part of some of the issues, and your website, I think, will help people even more. We haven't had a chance to talk about the future of Medicare, but that's for another day, I think. Thanks for coming in.
Thank you for having me.
When we return, we'll explore resources to help you record your personal history. So please stay with us. We'll be right back.
Hey, mister! Down here. You illegally passed the stop school bus. I'm placing you in timeout. And this timeout means big fines, plus you really could have hurt somebody. That's why school buses are being equipped with video cameras to help kids like me stay safe. So respect the bus.
Did you know there are more than 10,000 county government phone numbers? But there's only one number you need to remember for non-emergency calls, 311. MC 311 is Montgomery County government's online telephone information system. Need information? Have a problem or complaint? Trying to locate a county government facility? Call 311. The call center is open Monday through Friday, 7 a.m. to 7 p.m. The website is available 24 hours a day, 7 days a week.
Welcome back to Seniors Today. The Association of Personal Historians is an organization made up of individuals who can assist others in writing and recording their life stories. And joining me to tell us about some wonderful opportunities are Pat McNeese, the past president of the Association of Personal Historians, and Debbie Brodsky, president of DMB Pictures and also a member of the association. Well, welcome to Seniors Today.
Nice to be here.
So, Pat, what is this personal history saga? What is it all about?
Well, it brings that whole thing of celebrity biographies and celebrity videos to the level of the average person. Technology's made it much easier to do a book with somebody's life story, and personal historians come in and will do an interview. I go in and do an interview. In this case, this man, Firestone, took my life writing class, and so sometimes they may write their own stories, but often we go in and interview somebody at some length and then turn their story into a narrative, put it together with pictures, and do a book, or sometimes do a website like for a family story so everybody can share it. Basically telling the stories of a person or a family so that it'll be there for the next generation.
So there are a variety of ways, including you do videos, right?
Mm-hmm.
Yes.
So what does that mean?
So doing a video personal history is a little bit different than doing a book. With the book, you have actually a lot more time involved. Usually you spend many more hours. With the video, I'm really trying to capture me or whoever does one. You're trying to capture the essence of a person, you get a chance to really hear what they sound like and see their gestures and just get to know them so that future generations, whether they've don't remember them, or so they can remember them, or if they've never met them.
30 years ago, I had experience with my mother, who was then 85, and videos were not common. We did I guess you call it an oral history. A professional person like yourself came in, and we did 4 hours of tapes. The key, I think, is what you do is the right questions. What are the questions? And isn't that
Yeah,
a
and I
terribly
think
important?
with video also, I'm really trying to go after those most pivotal moments of someone's life, those really life-changing moments. So it could be something that happened in childhood, or meeting their spouse, or what career they had, but just those key moments. And often we'd like to enhance it with photos and music to really bring a story to life. So it's almost like you're watching your life story on TV.
With
So-
an emphasis on story.
On the story, yeah. So you've done a lot of these. I think some of them are more powerful than others, aren't they?
Yes, yes. You know, one project I did, this woman talked about segregation
Wow.
in Birmingham, Alabama. She had lived in the North and had moved down when she was a teenager. What I find so amazing about a lot of these stories is how much they impact the family. So the story, they did this for their 50th anniversary, and she talked about a story about how she was on a bus and how she would move if you were African American, you had to sit behind a sign, and she would move the sign up as far as she could. She'd push the boundaries. And so her second grade granddaughter saw this story and told the teacher the next day, and the teacher didn't believe her. And she said, "No, I saw it on this video, I'll bring it in." And so the mom actually brought the video in, and the whole class saw it.
That's sort of like her own Selma. I mean,
Yes.
the movie is
Right.
so powerful.
Right.
I began to see, well, wait a minute, what is this? What is this craziness? I rebelled. When we would get on the bus, they would have these little signs that you had to sit behind, colored and white, but you could move them. So I would move mine as far to the front as possible.
You also teach classes about memoir writing.
Yes. And there are classes all over with memoir writing. It's wonderful. It's fun for the students. It's great for teaching. I love teaching the classes.
Where do you teach?
At the Writers Center in Bethesda. I've been talking with Montgomery County about doing it in the 2 libraries, but I don't know if that's going through or not. What's nice about the whole the whole thing is a process, whether it's video, class.
Right.
The process is partly telling the stories and feeling heard,
Right.
and partly capturing it for the next generation. But the process of being heard,
Right.
it may be as important as anything else.
Well, my wife was a student of yours, and so we have a wonderful example of the stories that she wrote about her growing
Yeah.
up. You know,
Yeah.
I also had my own effort. I guess I started with genealogy to do a family tree, and then I got all this wonderful. So I made a book, and it was a long-term project, you know, and I think it does require a lot of work, and I think it would benefit from professional guidance, but it's fun to do.
Yeah.
What do you see? I mean, I express myself, but what do you think the benefits of doing whatever, whether it's memoir writing or putting a book or a video, what are the benefits to the person doing it?
From my own experience, I think it is a therapeutic thing. You know, they talk about the process of those life stages. It's sort of life review, right?
Yes.
And so you get a chance to feel heard, and it's also when you have someone that's a professional, and so they're a neutral party. They never heard your story.
Neutral but friendly.
Neutral but friendly, right, right. But they're excited to hear your story, and it's a way to sort of process and feel good about yourself. Look what I've accomplished, right?
One of the people I interviewed this year was she worked for the World Bank. She had been through the Holocaust, had survived, and the Holocaust Museum interviewed her for the Holocaust part of her life, but it ended there. They didn't care about what happened after.
Uh-huh.
I interviewed her for 2 hours,
Right.
and she gave the tape to her granddaughter to transcribe. That was the connection. The grandmother wanted to pass her story on and wanted her granddaughter to hear it
Wonderful.
and be involved. So it can be done all kinds of ways.
So there is a website of the Personal Historian
yes,
Association. What
yes.
is that website?
It's I think it's www.personalhistorians.org.
Uh-huh.
But you can just go on Google and put in Association of Personal Historians.
I looked at it. It's a very rich resource. I mean,
It's wonderful.
There's a
yeah.
There's a blog that has
yeah.
lots of tips for how to do it yourself, and there are. I mean,
Yeah.
it's not to say you should only work with the professional. Professionals give you structure. They give you that unbiased opinion. They give you time and
Yeah.
make sure it gets done.
Well, if we wanted to go down the professional, what's the range of costs? Because of course we're talking about videos, and we're talking, you know, give us an idea of what that might mean.
I think from a couple of $100 if you did something like the very bare bones minimum interview and nothing else,
Uh-huh.
up to tens of thousands. And sometimes you'll do a history of an organization. It will be even more because
Right.
it's much more complicated to gather the material.
Part of the difference of pricing is also the background and experience that people have.
Yeah.
You know,
Right,
some
right.
people.
It's
Debbie's from television production,
I worked in
documentaries.
television for 15
yeah.
years, and then I've
So
had this business for 9
yeah.
years, so I've been doing it a long, long time.
Yeah.
Right, and you've been doing it a long time too.
I have, and I worked in book publishing before, so it's
Yeah.
and freelance journalism. So the more you can bring to the table for the product and the process,
It looks like you both enjoy doing it too.
it's a lot of fun. I mean, if you're nosy and you want to hear people's stories, this is the perfect gig.
Well, I found it very rewarding, as you expressed it very well, for the person doing it, and then hopefully for the generations to come. They may not respond immediately, but in time,
Yes.
it's a wonderful thing to have.
I've had so many people say, "Thank God you got Mom's story before she died."
Yeah.
I've had a lot of clients or individuals pass away since we've done it, and there's so, I mean, it's the most rewarding job I've ever had because people
Yeah.
are so grateful
Yeah,
to have had
Thanks for coming in. It's a very exciting venture that you're both engaged in. Thanks for sharing
it was nice
Thanks
being
for
here.
having us.
Thanks.
When we come back, we'll close the show with a discussion with our council president, George Leventhal. So please stay with us. We'll be right back.
In Montgomery County, we have a goal to reduce waste and recycle 70% of all waste by 2020. By recycling and reducing waste, we save natural resources and make our community even better. So recycle at home, work, school, everywhere, and keep recycling going. For more information, call the Montgomery County, Maryland Division of Solid Waste Services at 311 or visit montgomerycountymd.gov/recycling.
Keep it going. Recycle more now.
Be active, Montgomery. Be active. Be active, Montgomery. Be active, Montgomery. Montgomery.
Welcome back to Seniors Today. I'm so pleased to have the opportunity to talk with the newly elected County Council President, George Leventhal. Mr. Leventhal, welcome back to Seniors Today.
Austin, thanks for having me.
And congratulations.
Glad to be here, and we're looking forward to a good year.
So, as Council President, what do you see as the primary issues for, things to be worked on during the coming year? I know we've had in the paper some issues about revenues, but where are we?
The economy is getting stronger, but we still have some shortfalls. I think every year the expectations of government, particularly when it comes to negotiated contracts, are kind of based on the assumption that revenues will grow fairly rapidly, and then we come face to face with reality that although revenues are growing, they don't exactly meet the projections. But each year we balance our budget, and we'll do it this year too. The complicating factor, of course, is what we don't know, is what will happen to us in Annapolis. We have a new governor. We wish him every success. He's got a big shortfall, and so we may be in a somewhat defensive posture. We're very dependent on state aid, especially for aid to vulnerable people, developmentally disabled populations, elderly populations. And so in addition to being president of the county council, I serve as chairman of the Health and Human Services Committee, and we're going to need to probably backfill what we anticipate will be significant cuts in state aid.
You have not only the Maryland issue, but of course we have so many federal agencies, and what the Congress does impacts on us too, of course.
Every layer of government interacts with every other layer of government, and when you're providing services to needy people, that's not something that we can count on the private sector to do. We've got to do it through the government.
But beyond the issue of which impacts on everything, are there particular subjects that you think are going to dominate the discussions? I mean, I think everything from transportation, taxi cabs to the vulnerable population. I mean, there's a whole range that you deal with.
So many. We're a big county. We're dealing with big issues. You're right. The taxi cab issue is one that significantly affects elderly populations. The taxi cab industry is facing a dramatic challenge from new modes, Uber and Lyft, and these smartphone app providers, and they need to be regulated as well. We need to make sure that they're safe and that they're insured and that they meet basic standards. And so that's a big bill that we're working on that elderly populations in particular should pay attention to, where you have folks who really shouldn't be driving themselves. They're very dependent on these forms of transportation, and we want to make sure that transportation is accessible to everyone, including paratransit. And so that's a big discussion with these new entrants into the marketplace, Uber and Lyft.
The council adopted, on the recommendation of the Commission on Aging and the county executive, a senior agenda the last couple of years. How do you see the accomplishments regarding seniors over the last few years?
I'm enormously proud of the work our county has done, most of which has come through the Health and Human Services Committee, which I chair.
Right.
And I have to give credit to County Executive Leggett. He has consistently acknowledged the importance of maintaining our senior population here in the county, preserving the talent and ability and the major contributions that our seniors make. And so we've created several new staff positions, and they're just excellent people in these positions. We have a mobility manager who is trying to help us coordinate, working closely with the Jewish Council for the Aging and other nonprofit service providers to make sure that folks are not isolated, that they have access to the doctor, that they have access to shopping and to vital services. And so we're trying to have a countywide comprehensive transportation system for the elderly. We also have a senior village coordinator because we're very much in step with this national movement where you have communities of concern, you have individuals who, again, we don't want seniors to be isolated. We want neighbors to reach out and help neighbors, and county government can facilitate that. We've got a number of these senior villages coming up all over the county: Olney, Bethesda, Chevy Chase, Silver Spring. We want to encourage that movement. It's a neighborhood-based movement, but county government is coordinating, providing best practices, fostering and supporting to make sure that folks can age gracefully with dignity in their homes and stay here in Montgomery County.
Well, you're right. I mean, the suburbs really were not made for aging. They were in the 50s. There was a whole different agenda. And how do we transform the suburbs, of which is mostly Montgomery County, And you've identified the things that are really key, the transportation, and the villages can help with that, of course.
Of course. Look, there will always be individuals who decide that they want a warmer climate, they want to live somewhere else. I don't think it's our job to prevent people from leaving, but I think what we need to do is emphasize the strengths and the desirability and the resources that we have here in the Washington, D.C. region. It's bigger than just Montgomery County.
Sure.
You know, when I think about what amenities are available to seniors, of course the most important thing for many seniors is to be close to their families, their grandchildren, and so those who have established a career and have lived in their homes here, we want them to be able to stay close to their families, close to the Smithsonian, close to Rock Creek Park, close to the C&O Canal, the beautiful resources that we have in this area. And so that does mean transportation, that does mean accessibility. It does mean mostly working with nonprofit service providers, working with faith communities, so that our elders have, a community that they're able to turn to that is supportive, with friends, people who they relate to. And so we have senior centers that provide that network, but we also have, a variety of communities in various faith communities, in the Asian community, in the Muslim community, in the Jewish community. Of course, the wide range of Christian, Catholic, and Protestant churches that provide places where seniors have people who they interact with, that they're not isolated. I think what we do cope with is a shockingly high rate of depression, and that relates from feeling left out and feeling neglected and feeling isolated. And so our biggest challenge is to provide both a transportation network to get seniors to where they want to go, and continue to provide resources and activities both through the public and private sector, because we value our older citizens and we value their input. You've been a great leader in drawing upon the talents and abilities of a multi-generational approach, having folks who are, with years of knowledge, a lifetime of experience, sharing that with younger generations in an intergenerational approach. We support that. We're supporting just a wide range of services to make transportation accessible, to make services accessible. And our fundamental point is we don't want anyone to feel alone, to feel that nobody cares. In Montgomery County, we are a caring community.
Well, you identified one of the things that we sometimes don't recognize, the benefits of an older population. They are a resource.
Indeed.
Or we are a resource.
Indeed.
Which we sometimes think of, what are the needs of, which is of course relevant, but it's a two-edged thing.
Indeed. In the month of February, the County Council is going to have a Black History Month celebration where we're going to honor our elders who lived through these turbulent times of civil rights and segregation. We've got to appreciate what our elders bring in terms of being able to explain to us our own history. We are the way we are as a community because of what occurred before us, and those who lived through these times, and especially Black history is a tremendous opportunity in the month of February, have so much to offer that we can learn from to better understand who we are and why we are the way we are today.
I'm afraid we're out of time, but you really touched upon there's work yet to be done.
Indeed, Austin, and thank you for your leadership in these issues over many, many years. We really appreciate it.
Thank you very much, and thank you for coming in. Good to see you again, George.
Good to see you too.
Well, that's it for this month's Seniors Today. Don't forget that you can access a great deal of information about county services for seniors by going to the Montgomery County Senior website at www.montgomerycountymd.gov/seniors, or call the Senior Resource Line at 240-777-3000. And as always, thank you for watching Seniors Today.
For those dealing with the struggles of caring for a loved one, we hear you. Visit aarp.org/caregiving for advice and support.